Hi everyone, welcome to today's video. I'm Mary Felling, physical therapist. So today's video is going to be a little different than previous videos because I can't actually show you how to do this. What I can do is show you how to connect to these pelvic floor muscles and how to use them so that you can benefit from using these muscles to maintain and improve your pelvic floor health. I'm also going to be sharing with you the information for how frequent to do these exercises so that you can get to optimal pelvic floor health and keep it. The most popular reason you've heard of Kegels is probably because of the PC muscles, the pubococcygeal muscles, and those are muscles that arise from the pubis and come down and they insert here on the coccyx. Let me give you a side view. So these muscles come from here around and insert here. Well, these muscles are important for maintaining pelvic floor health and pelvic floor stability. And we find often after childbirth with women, those muscles become a little lax and so they lose the tonus. When they lose the tonus, those women start losing the ability to have bladder control, sometimes bowel control, and other problems with pelvic floor. With a loss of pelvic floor strength and tone. So the first thing you need to do is find those muscles, learn where those muscles are. So what you're going to do, you're going to go to the bathroom, you sit on the toilet, and you want to get your knees wide apart. The reason is because we want only the pelvic floor muscles working. If the knees are together, it's easier to use your abs, your inner thighs, and your buttocks. So you're going to sit on the toilet, your knees are apart, start a stream of urine, and then at some point stop the flow of urine and stop the flow as if you were going to have gas, like you were trying to block gas from escaping. Feel what that feels like. Those are the muscles of your pelvic floor. And then release them, release that contraction, let the flow of urine go again, and then do it a second time. Tighten up, contract, and pull up all those pelvic floor muscles, squeeze them, so that there's no flow of urine and so that if you were to have gas, you would block the ability of the gas to escape, and let the flow go again. And maybe do that a third time so you can be familiar with what those muscles feel like to exercise them. Now, once you have a sense of what those muscles feel like, do not keep doing that technique on the toilet because it confuses the muscle, it confuses the bladder. It is a voluntary muscle. We're just doing that technique once or twice so that you can feel what those muscles feel like. All right, so now you've got what those muscles feel like. So here's the procedure. You can be in any position. Probably the easiest thing to do is either in sitting or lying. And you're going to tract those muscles and hold them tight for as long as you can. And then you're going to relax them for the equal amount of time. So you might be somebody who can hold these maybe just 2 seconds before you feel like you're losing the contraction. So you would relax them for 2 seconds. And then you would repeat that for 10 to 15 repetitions. Your goal, the first goal, is to get up to a 10-second hold and a 10-second relax. And you can do that. Everybody's going to have a different ability and capability with the strength and endurance of those muscles. So you might be somebody every 3 or 4 days, you can add another second on to that contract and release technique. Some of you might need a week between contracting, you need a week before you can add a second onto holding and releasing. So your goal is 10-second holds and doing them for about 15 repetitions each, twice a day. Just make sure you've got at least 2 or 3 hours between those repetitions because these are muscles and they need to have a break to recover from their last workout. So if you do get sore, if you're feeling uncomfortable, take 3 or 4 days off. It's not a contest. Everybody's going to be able to go at their own rate because everybody's body's different, and that's just fine. Be patient. Sometimes this can take months. For some of you, it might only take 4 to 6 weeks before you notice a real discernible improvement, but for some people, it will take longer. I can just tell you, be as patient as you can. It will happen. You are strengthening it. Dr. Kegel recommends 10 to 15 repetitions when you're doing them. I have noticed with OB-GYNs over the years, they are saying maybe more like 15 to 25 repetitions. That's what Dr. Hutcherson recommends. What I will tell you is everybody's body's different. So do what works for you. If you're doing 10 to 12 or 13 repetitions and you feel like you've had a workout, that's great. You are getting the benefit. Don't worry that you're not doing 20 or 25 repetitions. If you're doing these exercises, you've got to the 10 seconds and you think 15 repetition isn't much, go ahead, add some more repetitions on 20, 25 repetitions or for a total, not an additional. You won't injure yourself. You'll just get stronger. But I want to make it very clear that everybody's body is different and you have to honor where you are. You're not doing poorly because you're only doing 14 or 15 repetitions. That's where you're at. If you're doing 20 or 25 repetitions, stay in a place of gratitude that your pelvic floor is that strong, because not every man and woman has that ability. Once you've gotten to that point and you're doing your 20, it's been 2 months now or 6 weeks, and you're able to do those 10-second holds and relaxes after, and you've been doing this daily, by the way, then you can go to just doing these exercises twice a week or maybe 3 times a week. And that'll help maintain those positive changes you've just worked so diligently for over the last few months. This is the best way I know to give you maybe an increase in difficulty. Once you're, after about 2 months, if you want, you can try these while you're lying down or standing. Try them while you're sitting, or if you really want to give yourself some a tough position, squat and do these. It just helps your system to work a little bit harder and a little bit smarter to get those muscles strengthened. I've put together a playlist for pelvic floor exercises if you want to learn some more techniques to continue to improve any pelvic floor problem. If you haven't already, I invite you to subscribe to my channel. You'll be notified every time a new video comes out. That allows you to continue to self-treat and live that pain-free, active lifestyle that you deserve. Thanks again for joining me. I'll see you in the next video.